Hi, I'm Dr. Stephanie Handler. I'm a urogynecologist here at UCR Health. The top two conditions that I treat by far are pelvic organ prolapse and urinary incontinence. Pelvic organ prolapse is a really common condition. It affects up to 50% of women, and it's when some of the organs in the pelvis, for example, the bladder, the rectum, the vagina, or the uterus, can prolapse or herniate downward in the pelvis. In other words, sometimes it feels like there's a ball coming out of the vagina. Some women don't feel anything at all. Some women feel like a pressure in the pelvis. Some women feel a ball or a bulge, or can even see it if they look between their legs. It's not a dangerous condition, but it can really affect a woman's quality of life and make her day-to-day activities really burdensome. There are different treatment options for pelvic organ prolapse too. A woman can just wait it out and see if it gets worse on her own. She can do pelvic floor exercises either by herself or with the help of a pelvic floor physical therapist. There are non-surgical treatments, mostly by using a device called a pessary, which is a comfortable, small silicone device that's inserted in the vagina and lifts up the prolapsed organs. And then, of course, there are a few different types of surgery that we could do to permanently correct the problem. At UCR Health, we emphasize a minimally invasive approach to surgically correct these problems. Most surgeries for pelvic organ prolapse can be done vaginally, so that means no incisions on the belly, fast recovery, great healing, and going home from the hospital the same day. We also can do laparoscopic surgery, which is where we operate with 3 to 5 small, tiny incisions on the abdomen. And again, women do really well in terms of pain, recovery, and going home the same day. I think it's important for women to understand what their priorities are. Sometimes women can have a few different pelvic floor disorders at the same time. We can address them all, but it's important for me as your teammate in tackling these issues to understand what's most bothersome to you so we could start there first. Urogynecology, I think, is a really special field. I treat women of all ages, but maybe I see women who are around the age of menopause or older than that most commonly. I think it's really hard to go through that transition in life, and women's bodies often change, and sometimes women feel like their bodies are foreign to them. So I try to think of myself as a patient's partner in getting reacquainted with the body and coming up with holistic, comfortable ways of addressing these problems.